In 2014, we decided to test the hypothesis that wellness could be quantified by these personal dense dynamic data clouds. And I persuaded 108 of my friends to undergo a 9-month study with complete genome analysis with 1,200 blood analytes that we measured every 3 months, with the gut microbiome every 3 months, and with quantized self-measurements. And when we integrated those data together, they led to, for each individual, to a unique series of actionable possibilities, which if acted upon, improve wellness and or let them avoid disease. And at the end of this more or less year-long study, virtually all of these people wanted to continue, and that's why we started the company Airavail that brings scientific wellness to consumers. So we have now about at least 60 of these individuals in the Airavail program, and we have longitudinal data for almost 4 years on them. And of course, the longitudinal data is critical because it's then you begin to see the wellness to disease transitions we'd like to characterize. So I think the take home for this group with regard to precision medicine is, one, you need to think in terms of dense phenotyping rather than just genomic analyses. And number two, it's critical to have longitudinal data that lets you look across long periods of the individual or patient's lifetime to see how they're changing in their state from wellness to disease, or disease in response to therapy and things like that. So precision medicine, precision cancer is going to undergo an enormous evolution over the next few years. So perhaps the most interesting study was the 69-year-old lady that had stage 3 bladder cancer. She had been a client of the scientific wellness company Airavail since the beginning for the last 3 years. So what they'd done for her, I think, is very nicely optimized her wellness with regard to nutrition, with regard to inflammation, with regard to cardiovascular, diabetic features, and so forth. When the cancer diagnosis came, then we did the classic precision medicine analyses that's practiced all over the world today, analyzed the tumor, looked for the variants, used the variants to determine what drugs might be appropriate. Then she underwent a first-line set of chemotherapy to reduce the tumor. Then she had surgical recession. And then finally, she went through a much more detailed phenotype analysis where we put in, for example, 5,000 proteins, and we took it every few weeks. So we had an enormously detailed analysis of the blood analytes, of some of the hormones, of a whole variety of different kinds of things. And that was the scientific wellness aspect of it. And what those analyses showed us quite clearly is, one, she was extremely healthy going into the surgery, and two, her immune system had been dialed perfectly to present her with the opportunities for immunotherapy that could be maximally effective. And these deductions came from an analysis of RNA and protein analytes and so forth. One of the features we did that was utterly fascinating is we used CT scanning to convert it into a 3-dimensional hologram both before surgery and after surgery. And essentially, this hologram showed her entire abdominal region, and with clicks, you could remove organs that confused the relationship of the tumor to the bladder and the tumor to arterial vessels and neurons and everything. And the surgeons, before they did surgery, found this 3-dimensional hologram unbelievably useful in knowing exactly where how the tumor was positioned, where it and to what extent it had invaded the bladder, and the fact that it had missed local lymph nodes, it had missed the arterial and neurologic system. So they went in and had a flawless, very, very rapid surgery. And of course, that together with the analysis of all these analytes left her in really good shape for the future. And she'll be followed in a similar vein very, very carefully. But there's enormous optimism for the next stage, if that's necessary, actually being immunotherapy. So what we were able to do in sum is to use this enormous amount of data we generated to predict the trajectory of her disease and how you should respond at each stage of that trajectory, which was an enormously beneficial thing to the patient, to the physicians taking care of her, and to her husband as well. Well, the other thing I'll emphasize is we've only begun to analyze the enormous body of data we gathered on her. So there'll be many more exciting conclusions coming. But what we're getting set up to do is follow in exactly the same way bladder cancer patients in the future, and to compare their N-of-1 studies and see where they reinforce one another and where they reflect the uniqueness of each individual to the cancer and the need for unique therapeutic approaches to each individual. Let me just say first, it's just being initiated now, so we're at the earliest stage. But the idea is to take 100 women that have gone through the rigors of breast cancer. And normally, when women go through the rigors of breast cancer treatment, there are a whole series of 20 or more complications, including intractable pain and a whole variety of other things that occur. And what we hope with this dense phenotyping, the personal dense dynamic data clouds, is to be able to assess in different individuals each of these complications and gain a molecular understanding of how we might manipulate them, either to moderate them and or to ablate the suffering the patient serves. So the hope is that you can use scientific wellness to bring women who ordinarily suffer quite significantly very quickly back to a healthy state. And we're taking about 100 women, and they'll be compared with 100 women that will be controls and won't go through the dense phenotyping and things like that. Oh, I do, because what we've seen with 4,000 individuals already are 60 wellness to disease transitions, more than 20 of which were cancer. And we hope to have, in a few years, about 100,000 patients, 25 times as many as we have now. So we'll see 25 times as many wellness to cancer transitions. And by being able to categorize those, get the earliest transition, we think these will be utterly ideal patients for the kind of therapy they're talking, the kind of therapeutic approach they're talking about.